Okay, good morning. Welcome to this training for this year, COVID-19 Prevention Plan. It's SOP ST0019, training for the 2022 year. So here are the subjects that we're going to be covering today. Similar as to last year, we'll have terms and definitions, employee requirements, communication, work procedures, facility control procedures, physical distancing, face coverings, COVID-19 training, cleaning and disinfection, daily home assessment, health and hygiene procedures, visitors and contractors, vehicles, reporting, exclusions and quarantine, vaccination, COVID-19 testing, and at the end we'll have questions and answers. So here are a few terms we want to discuss with you, since we are going to be using these frequently when we do have an exposure, we have a case, and we have to communicate with people. So when you hear exposure, this means contact with someone infected with SARS-CoV-2, which is the virus that causes COVID-19, in a way that increases the likelihood of getting infection with the virus. Sorry for that misspelled word. It's by the way that it increases the likelihood of getting infected with the virus. The close contact, what that means is someone who was less than 6 feet away from an infected person with a laboratory confirmed or a clinical diagnosis for a cumulative time of 15 minutes or more over a 24-hour period. So what this means is that a person has to be within 6 feet or less of a person who has a confirmed case of COVID or a clinical diagnosis of COVID-19 for a cumulative time of 15 minutes. So this could be a minute or two in the morning, another minute or two later in the break, maybe 10 minutes during lunch, another 1, 2, 3 minutes throughout the day. So it has to be a cumulative of 15 minutes. But if someone's close to someone for 6 feet or less, 15 minutes at one point, you've already exhausted your allotted time or your cumulative time there. And it has to be within the last 24 hours. So if someone tells us they had COVID-19 today, the questions would be who was exposed, right? And who had close contact to this person. So we make a recollection of the last 24 hours of that person being on site, being at work, or at home, or wherever you went. So those people that are identified as close contact would get another notice from us, okay? So a person will be considered to have COVID-19 if one of these three scenarios exist, okay? A person has received a positive COVID-19 result. So say someone is sick or they have symptoms or they've been notified that they've been exposed, they go get a COVID test and it's positive, and it has to be an FDA approved test, you will be considered of having COVID. A person who exhibits symptoms of COVID-19 and who are awaiting a test result or have not been tested will be considered having COVID-19. Sometimes people say, oh, it's just a cold, it's nothing, but we really don't know that if you don't have a test, correct? So if you do have symptoms and you go get a test and you're waiting your result, you will be considered to have COVID-19. If you have any of the COVID-19 symptoms and you do not go get tested, you will be considered to have COVID-19. And lastly, the person who has known exposure to an individual of COVID-19 and exhibits symptoms. So if you had known exposure to a positive case and you have symptoms, you will be considered to have COVID-19. The other term is COVID-19 test. So this is a test that can detect either the SARS-CoV-2, which is the virus that causes COVID-19, or any antibodies that your body makes, right, after contracting COVID-19, or if you get vaccinated, you will have these antibodies in you, okay? There are two types of viral tests. There's a rapid test that a laboratory test of COVID-19. So basically, these tests in one may risk reduction measures, right? So get tested along with your vaccinations, along with wearing a mask, and along by keeping social distancing, right? This protects you and others around you from spreading COVID-19. So a rapid point of care test. So basically, if you go to a clinic, urgent care, COVID-19 testing site, emergency room, or your personal doctor, they will perform this test, right? There's also a self-home test that you can administer yourself which is an antigen rapid test. The laboratory test will take a minimum of 24 hours to 72 hours for the result, which is a PCR test, right? And this test requires a laboratory to dive deeper and look into the nuclei and everything that goes along with the detecting the COVID-19 virus. These tests must be cleared, approved, or authorized, including an emergency use authorization from the United States Food and Drug Administration. So these tests have to be FDA approved. If you happen to choose a test to do at home, in this chat for today's meeting, you will get a link, okay, that will allow you to look up the product name and to see if it's FDA approved or not. Fully vaccinated. What this means is the employer has documentation that a person has received their primary series of COVID-19 vaccines. So those of you that have been vaccinated and received your first 2 doses, if it's Pfizer or Moderna, or 1 dose if it's Johnson & Johnson, and you have submitted your documentation through the Kokomo app or to the Stay Safe team, you will be considered fully vaccinated, okay? The other term that is being used nowadays also is up to date. It means a person has received all recommended COVID-19 vaccine and have either received a booster shot or is not yet recommended to receive a booster shot dose according to the CDC guidelines, okay? And we also have that documented if you received your booster, right? If you qualified for your booster and you've taken it, you'll be up to date. If you do not qualify for the booster, you will be considered up to date, okay? The other term is not up to date, which means a person has not received all COVID-19 vaccinations indicating according to the CDC. One is that you have not been vaccinated whatsoever. You will be not up to date. If you've taken 1 dose of 2 required doses and you're still waiting for the second, you are not up to date. If you've taken the first 2 doses and you qualify for the booster and you have not taken the booster, then you are not up to date. Employee requirements. As everyone here on this training, even myself and every manager, as an employee, we have responsibilities. And our responsibility is to, use safe work practices whenever we're here at work. And those of you that are working at home, follow proper care at your home, since that's where you're working, right? So make sure you know all the policies, all the procedures, and assist in maintaining the work safe environment for everyone else. We encourage everyone to participate in identifying and evaluating any COVID-19 hazards that you may see or that you may come across. Stay informed about updated protocols. That's why this year we made some changes, so we're having that training again. And throughout the year, we will send out information as things change or they evolve, or if we have any new protocols that we want to share with you, we will make them known and available to you. Stay informed and compliant with any required social distancing, personal protective equipment, and other health practices that we may implement here at work. You want to make sure you protect high-risk people or people that have adverse health conditions. If you know of any such people, you want to make sure you protect them. You want to clean and disinfect as far as our protocols go. Ensure in this one here, we do have a protocol that the janitorial staff is implementing, but I know of some departments that have additional cleaning and disinfecting protocols of their own. For example, the warehouse, they have a protocol that every forklift driver is to clean and disinfect their forklift prior and after every use. The truck drivers or the people that use our company vehicles, they are supposed to be cleaning and disinfecting their vehicles. So if your department has other specific things, you want to follow those as well. Ensure you're using the required PPE. We also encourage everyone to not or to limit the use of shared equipment. For example, phones, headsets, desks, keyboards, writing materials, and tools and stuff like that. Try to keep your own tools for your personal use only. If you have to share equipment for whatever reason, then we ask you to sanitize prior and after each use. Communication. So we require that every employee communicate to Human Resources or the Stay Safe team if you have COVID-19 symptoms, if you recognize any potential hazards of COVID-19, right? And Houdini will communicate with all employees regarding a plan for providing testing if required. We will provide COVID-19 testing if it's mandated by a local government or if there's a minor outbreak. Some of you may remember late last year in December and early this year in January, we provided on-site testing for employees because we entered to what's called a minor outbreak. We had certain cases in a certain period of time that we had to provide testing for you, and we made it known through an email that was sent out by the Stay Safe team and HR. We will also inform exposed employees and the possibilities or consequences of a positive test. So if someone was identified as a close contact, we would contact you directly, personally, and let you know what the next steps you are to take. And if you did provide a positive test, you would probably have to be excluded from the work. Anyone with a positive COVID test may be excluded from the workplace or until the return to work requirements are met. And this year we've created a form called Form ST0037, which is the current year, 2022, updated COVID-19 quarantine isolation return to work guidelines. That will be available to you also as an attachment to this chat. When we're done here, Griselda will upload them. They're also available through document control, or you can request it from the Stay Safe team. Anytime things change, we'll update that form and we'll make it available to everyone. If an employee is excluded, information on available benefits will be provided to you by our Stay Safe team or the HR department. Daily home assessments before coming to work using Kokomo 24/7 COVID tracker is a requirement for all employees and for Houdini employees only. The agency, they have their own procedures on how they do home assessments. And we encourage to communicate via video calls or chat messaging to eliminate face-to-face interactions. Worksite procedures, these have not changed. I don't want to get into too much detail with this. It just remains the same. You know, we have changed things. We've modified lunchrooms and so that way people can kind of maintain their distance. In certain areas, we couldn't do it, like in production. So we've implemented curtains or barriers. So all of this stays the same to try to maintain people having 6 feet away where possible. This has continued, the cleaning and disinfecting. Our janitorial staff is doing a great job cleaning high-touched areas and if required, they are cleaning certain areas more deeply if needed. Okay, we do want to continue eliminating non-essential visits. Let's see, we've staggered the shifts in some areas and some locations for the lunches to maintain a good number of people in certain areas. We do monitor employees' wellness. So if someone does feel sick or does not look right and you don't want to say anything, you can make an anonymous call or anonymous email or whatever communication to the Stay Safe team, and we'll investigate it further. And any investigation that we do here, it will remain anonymous. So just, you know, rest assured that your names and stuff like that will not be communicated to anyone. Facility control procedures. We have set up hand sanitizer locations throughout the facilities. We've posted PPE signs and banners, so to make you aware of what we're still doing as far as washing and sanitizing your hands, keeping 6 feet apart, and wear a face mask where required. Let's see, building capacity planning. We just kind of made sure that we don't have crowded areas or allow more people than what should be allowed in certain areas, in certain conference rooms, in certain offices. We've asked some departments to limit their or spread people out throughout the building rather than just in a single office. We've reconfigured them. We've put up some barriers where needed. In the receptionist, you saw that we put barriers so that way they're not up close. airflow remains the same because we are a food grade facility. We're not allowed to open windows in the warehouse or doors in the warehouse, but we do have fans circulating the air. Let's see. Physical distancing still remains the same. We expect everyone to maintain a 6-foot distance for the time being until that changes. No physical contact as far as handshakes, hugs, and stuff like that. Uh, we and this is hard to do. Bullet point number 3, when you're walking with someone to a certain area, it's normal, it's typical to walk side by side. Even though you shouldn't be walking side by side, you should have some type of distance between you. We still see it, and just try to remind people, keep your distance 6 feet. Employees on-site scheduling has changed to eliminate a lot of people coming at the same time or leaving at the same time. Bringing food from home is recommended. Again, we're trying to eliminate catering people to come in. Now, this past year, we did allow the food truck to come to the buildings, but in Buena Park was the only place it was available to bring the catering truck, the food truck. And Fullerton, the service was not available, so that's why Fullerton didn't get one. It's not that we just chose a certain building. MS Teams for meetings when possible to continue that physical distancing policy. This remains the same. We've added, we still have the floor locations or markings to identify where to stand or to make sure people have high visibility to the social distancing standards. Time clocks in the break rooms, some entering the restrooms, the call center. We've done that. The hallways have been designated for certain, one-way traffic. For this slide, COVID vaccine and statistics, we have not shared this information with anyone in the prior, since the pandemic. It was only between the COVID committee. But this year we decided to share it with you, and I'll have Griselda go ahead and share this information.
All right, thank you. So, as you all know, the pandemic started 2020, and that's when we had a lot of people, get sick, they were exposed. And so the amount of people that we had that they needed to get tested was 424 people. So out of those 424, 119 turned out to be positive. Now, if we move on to the year 2021, it went a little lower. So 174 employees, they had to get tested because they were exposed or was experiencing symptoms. And out of those, 58 tested positive. Now moving on to this year, as you can see, just most of the number is between the month of January and the beginning of February. So that's probably around 60 of those. And then up to right now, it's we've had 61 who needed to get tested. And out of those, we've had 26 that tested positive. Now, that number is almost half the amount of what we see from the previous year within just the first month and a half. And moving on to the vaccine status, the people that have submitted, their vaccine cards, where we have a copy. Out of the 242 employees that are currently active, 114 of them have submitted a copy of their vaccine cards. So that makes it around 45%.
47.
47.
But who's doing the math right? So that increased a little bit. Thank you, Griselda. I just want to touch a little bit on here and kind of tell a story and as to why we still have these policies in place. Okay, we know that California and the CDC, well, the CDC is recommending now they're lessening the requirements. People are not recommended to wear face masks now out in the public or in certain indoor facilities and stuff like that. And that's something that we have to view as our COVID committee. We look at those things. We look at these statistics that we have here on site. We look at what's going on and how people are, acting or behaving in relationship to COVID-19 and our policies. So for 2020, That's about 28%, right around there, that people that got sick who tested positive, right? In 2021, it's increased to 33%. Less people, less cases, but in relationship, it's 33%, right? So it increased. And then this year, just in the first 5 weeks, you know, we're already in March and we haven't had a new case, but in the first 5 weeks, we had 26 cases. 61 people were either had close contact or were ill and had symptoms. And those that got tested, we had a 43%. So every year it's been increasing, and we just started this year, right? And because our vaccination participation is under 50%, we still want to keep people safe. We still have that responsibility. Now, if we had more people vaccinated, I'm just going to throw this number out, but don't take it literally. Just think as an example, if we put like, if we had 80% vaccination ratio, then maybe we can relax our policies as well. But until we see that, or if we don't ever see something close to that, we still have to maintain our policies. So with these numbers, with the analysis and the evaluation that the COVID-19 committee has made, we're going to maintain the face covering mask mandate here in our facility. One thing is a public area, and the other thing is a private area. Okay, so Houdini is a private company, so even though the rules and the laws or the mandates are being lessened in California and by the CDC, that the requirements for employers to maintain a healthy and safe work environment for their employees still lies on us as a responsibility. And there's a provision in those new requirements or those new procedures that the CDC in California are issuing, is that the employer, any private employer, still has, the authority to mandate their own mask requirement. Having said that, the face mask is still mandatory for all employees to enter this building if you work for Houdini. Okay, one country gift baskets. So employees who are fully vaccinated must still wear face covering here, regardless of what you can do out in the public, out where you're not covered by our policies. All face coverings must continue to cover your nose and your mouth. Cloth face coverings should be washed frequently. Replace face coverings when damaged. The supply of disposable face coverings will be available to all employees still. A supply of respirators will be provided to non-vaccinated employees for voluntary use if you choose to wear a respirator, or anyone that wants to use a respirator. For that, you require additional training on how to use clean respirator. So if you wanted to use one, let the Stay Safe team know, or you can email me directly and we can provide that documentation and training for you. So, but there are still some exemptions, and these are the exemptions. Face covering exemptions are if you are fully vaccinated, if you're alone indoors or outdoors. But let me clarify this, because there is some confusion where people say, well, I'm fully vaccinated and it says indoors. When we talk about indoors, it means that you're in an office by yourself with four walls and a door. As soon as someone else walks into that office, then both of you, or the person that was not wearing a mask, has to wear a mask. Okay. If you're outdoors by yourself, having lunch on your break by yourself, or walking around the building by yourself, you can lower your mask. But if you're taking breaks and lunches or walking with people outdoors, you must wear your mask. If you're eating or drinking, provided that all employees are at least 6 feet apart, you can bring down your mask. Now, some people say, well, I'm on break, but you're not eating and you're not drinking, right? So even though you're on break or you're at lunch, if you're not eating or drinking, your mask has to maintain on if you have other people around you, okay? If you're wearing a NIOSH approved respirator, such as an N95 mask or N95 respirator, you do not need to wear an additional mask or face covering. Specific assignments that cannot be done with a face covering Here in Houdini, we have not identified a task that requires you not to wear a mask, so everyone should be wearing a mask while working. If a person has a medical condition, a mental health condition, or a disability that prohibits them from wearing a face mask or a respirator, then they will be exempt. But for that, you will have to contact Human Resources and request an exemption. It has to be documented before it's granted. Uh, if you're hearing impaired or communicating with a person who is hearing impaired and they need to see your mouth, like they can read your lips, is essential, then you can lower your mask for that process. But once you're done communicating, then you have to wear your mask again. If wearing a mask poses a health risk, as determined by the local, state, or a federal regulator, then they can say you no longer have to wear a mask. But until that happens, we still have to wear it. If anyone has trouble breathing, that you have an exemption. But for that, you do have to contact Human Resources. They might require a medical exemption, and then it'll be documented, and then you will be granted that exemption. If you operate a single occupancy vehicle, that means for work purposes. For those of you that work between buildings and have to, travel between the buildings, if you're by yourself, you do not have to wear a mask. If you have a coworker or a companion inside your vehicle during working hours, you must wear a mask. Okay, and once again, just as a reminder, you must go to Human Resources to request an exemption. These face coverings are not authorized, so same as last year. Scarf, ski mask, balaclavas, bandanas, turtlenecks, collars, or single layer fabrics. It has to be dual layer. Some people say, well, I have a face shield. No, you have to wear a face mask and a shield if you want to wear a face shield. One change for this year, as far as face coverings, the shields are no longer required, right? If you do wish to continue wearing a face shield, you may wear it, right? But you still have to wear a mask underneath that face shield for those employees that prefer to wear a face shield for added protection. And just remember that a face shield alone does not replace the face mask. COVID-19 training. So these are the topics that we're required to give you training on, and most of them we're covering here. COVID-19 prevention program, identifying symptoms. That goes with your, how to identify symptoms, your self-assessment at home. And those symptoms that are you see on the app, those are how to identify those symptoms. Standard hygiene and heightened hygiene practices we cover here. Personal protective equipment we covered. Housekeeping we'll cover it here. And reporting protocols, it'll be on the reporting section. And COVID-19 communication, we've already covered that. So these are the subjects that you are to be trained on. Cleaning and disinfection, this goes with housekeeping. So our janitorial staff, they have a procedure outlined as far as what they're doing in addition to just general janitorial tasks. So they're cleaning, disinfecting high touch surface areas, doorknobs, railings, lunch tables, more on a frequent basis, and so they're doing a great job. So kudos to them. So your daily home assessment. So basically, and this is for everyone that is scheduled to work on a certain day, you must fill out a survey. If you have a planned day off or you're on vacation, then you do not have to do it. You may get a notification if your supervisor or manager did not submit that information to the Stay Safe team on time, where we will suspend your account for that time that you're going to be out. So make sure that if you do get this notification and you did submit a request for your time off, you do not have to fill it out. But if you're going to be out sick, if you're going to have any symptoms related to COVID-19, we want you to let us know through the application. Now, for those people that you're going to take you want to take a day off because something other than yourself, you have something else, with your family members or what have you, then you can go ahead and say not COVID related, and then you have to communicate to make sure that is an excused absence. Okay, so everyone has to do this regardless. The reason why we say that, and I want to iterate it, is because we had people saying, oh, I didn't know I have to do it. I was out sick. everyone has to fill out a survey regardless. Okay, so we encourage you to participate. Health and hygiene procedures. So you want to notify human resources or the Stay Safe team if you have any type of symptoms. Uh, you must be separated from other employees and be sent home immediately if you become sick during your scheduled shift and you're on premise. You should cover your nose and mouth with a tissue when coughing or sneezing and discard it in the trash can immediately. Do not touch any other things until you've washed your hands or sanitized your hands. Let's see. There we go. Visitors and contractors follow the same procedures. So if you as a member of Houdini One Country Gift Baskets are expecting a member from like a contractor, a visitor, a client, a customer, or whoever, it has to be pre-approved by the COVID Safety Committee, and they have to fill out a survey prior to coming to the building. We can provide you a QR code and you can send it to them as a link, or they can scan the QR code at the front lobby prior to coming into the building. And they have to practice social distancing, no handshakes or greetings with physical contact. If they have symptoms, it will be prohibited from entering the building. They have to reschedule and make sure that they follow these policies. If they don't, they will be asked to leave the building and not return unless they've been pre-approved again and they have to follow the policies. Personal protective care. So hygiene, wet your hands, apply your soap, wash for 20 seconds, dry the hands, turn off the tap with a towel. Alternatively, use hand sanitizer. And why we have this is because we have to let you know and we have to document that, yeah, we provided you the steps to wash your hands. I don't know if anyone here has witnessed what I witness at times where I'm in the restroom and people go in there and use the restroom and they just walk out without washing their hands. Or they just turn on the water, run the hands under the water, turn it off, and exit. They don't use soap. They don't wash thoroughly. So this is why it's here this year. Respirators and face coverings, you got to make sure you know how to put it on and how to put it off. Take it off. Wash your hands prior and after you go to your face and applying or putting on or off the face mask or respirator. Use your fingertips to mold the nose strip on your face. If you do not have a mold strip, then maybe you should change your mask to one that has a mold strip. That way it covers your nose. I see a lot of people with face masks that are just constantly coming off your nose because they don't have that metal or a molded piece that you can put over your nose. And you want to remove it by the straps and do not touch the respirator or the face piece of it. You want to use the straps over your ears, or if it's over your head, you want to take them off over your head. For those of you that wear gloves to do any type of the task, you'll have to wash your hands before and after each use of the gloves. And how to put them on, you want to make sure you slide it, the glove fits past your wrist. If you have gloves that only go to the palm, those are the wrong gloves. It has to be covering your wrist. And to remove the wrist, you want to pinch at the palm, at the heel of the palm, and with one hand and pull it off your fingers, off your hand. And then with the exposed hand, you want to put your finger underneath the wrist area and pull the glove off of the second hand. That way it eliminates you from touching the exposed areas of the glove where you've been touching the surfaces. Okay, you want to discard them in the container and wash your hands immediately. For trash bins, the trash bins, you want to make sure if you do use any of the trash bins that you do not touch any surfaces. If you do happen to touch the surface, you want to go ahead and sanitize your hands and wash your hands. And the bins should be sanitized frequently as well. That's for the janitorial staff. Vehicles. If you happen to use a company vehicle to do business in between buildings, you have to wash your hands before and after driving. Wear gloves outside the vehicle, especially when refueling. You want to wipe down and disinfect the inside of the vehicle, anything that you touch with your hands, right? If you use your personal vehicle for business, that's going to be up to you to clean and have your vehicle sanitized if you are going to have passengers with you. As far as reporting, employees are required to contact human resources or the Stay Safe team if you have symptoms or recognize any hazards. If you actually also see anyone sick at work, you want to report that so we can further investigate. Employees must report to their supervisor and the Stay Safe. I should be the safety manager if you suspect potential COVID-19 exposures. As far as anyone being 6 feet or less, commuted with 15 minutes or greater for the past 24 hours. Exceptions, if you wore a respirator within 6 feet of a COVID-19 case during the high risk exposure period, you are exempt from, being excluded from the company or from your work area. And Houdini will track all COVID-19 cases and keep such information private. So if you do provide us that information, we will not share it with anyone. The only information we share is with you personally. Your supervisor, your manager, they will only get a notification saying that such employee will not be at work, and we just leave it at that. And then when you're eligible to return, we just notify them that you're eligible to return. We do not give them any details. Exclusions and quarantines. Okay, so COVID-19 cases will be required to quarantine for a minimum of 15 to 10 days. If you remember when the pandemic started in 2020, you were supposed to be excluded for 14 days and you weren't allowed back until you tested negative and you were free of all symptoms. And then last year it was 10 days. And now this year it's moved a minimum of 5 to 10 days. And we'll explain why these changes occurred. Okay. If a person had close contact with COVID-19 case, will be excluded from the workplace, except under these following conditions, okay? If an employee who is up to date with their COVID-19 vaccines before the close contact occurred, right, and you do not develop symptoms, you are excluded from quarantining. I mean, you're exempt from quarantining or being excluded from the workplace. If you're a COVID case and return to work, meaning that you had COVID-19 and you've recovered and you're back to work and you remain symptom-free, you will not be excluded or you do not have to quarantine if you've been exposed. COVID-19 cases that never developed symptoms, meaning that you had COVID-19 and you were asymptomatic, not having symptoms, and you've returned back to work, and you've been exposed in those next 90 days after the first positive test. So you, per se, for lack of a better word, is you have immunity for 90 days, right? That you don't have to be excluded or quarantined from work if you've been exposed to a new case. The quarantine period will be determined by the CDPH, which is the California Department of Public Health. Local health requirements, since we operate in the Orange County, so the Orange County Health Care Agency, we follow their requirements as well, or from any specific isolation order. Let me give you an example here. Those of you that are working in Fullerton, okay, if the city of Fullerton, they experience a outbreak only in that area, Fullerton can mandate additional, procedures that do not affect Buena Park. So Fullerton has to follow those local mandates and not Buena Park, and vice versa. Exclusions and quarantines. So we're going to ask you to refer to this page that Griselda is going to post, which is the FRM, which is the form ST0037. This is outlined with definitions and a table that you can follow certain scenarios. If you fall under this scenario, this is what you have to do, right? And that is communicated through the Stay Safe team. Okay, so scenario 1. A person tests positive for COVID-19 and has symptoms. So this person shall immediately self-isolate at home for 5 days, right? And not come out, don't have interaction with anyone, because this is the crucial time where you can infect other people. You can end your isolation if all of these 4 things occur. Number 1, at least 5 days have passed from the symptoms onset. At least 24 hours have passed since resolution of fever without a use of fever-reducing medication, meaning if you had a fever, you have to be off your medication for 24 hours and 5 days have passed before you return to work, and other COVID-19 symptoms have improved, with the exception of the loss of taste and smell, because those two can take longer than 5 to 10 days to come back. So that means you're no longer coughing, you no longer have chills, you're no longer sneezing, you no longer have diarrhea if you had it, because those are bodily fluids that are coming out of you, right? And lastly, you also have to take an FDA-approved authorized COVID-19 test, antigen test preferred, and it has to be negative after day 5, right? So you want to take that on or after day 5. So on your 5th day, if you no longer have symptoms, if you feel that you've recovered, you have to take a test on the 5th, the 6th, the 7th, or the 8th, 8th, 9th, or 10th day in order to come back, okay? For those of you that are unable to schedule a test or choose not to take a test, you have to meet the 10-day isolation requirement. And that's why it's anywhere between 5 and 10 days. Now, if you still have symptoms and it's been more than 10 days, you would still be excluded, because all of these 4 things have to occur before you come back to work. And that's where the communication with the Stay Safe team occurs. Scenario number 2. So basically, a person tests positive for COVID-19, but is asymptomatic. You don't show symptoms. So this person shall immediately self-isolate at home, right? You can end your isolation when these 2 things occurred. At least 5 days have passed since the first positive COVID-19 test. And then an FDA-approved authorized COVID-19 test, antigen test preferred, is negative on or after day 5 from your positive test. And again, if you choose not to test or you're unable to go get a test, then you have to wait the 10 days. Scenario 3, a person not up to date with their vaccinations and is exposed to COVID-19. So this person shall immediately self-quarantine at home and self-quarantine and your self-quarantine if these 3 things occurred. 5 days have passed since the contact with the COVID-19 case. No symptoms have been developed, and you take an FDA-approved test, and it has to be negative on the 5th or after the 5th day of exposure. If you're unable to take a test or you do not want to take a test, you must stay out the full 10 days. Scenario number 4, a person who is up to date and is exposed to COVID-19. Remember, up to date means that you're up to date with all your vaccinations. You are exempt of self-quarantine if they do not develop symptoms or you're asymptomatic after exposure. And scenario number 5, you've been previously infected with COVID-19 and there is a new exposure, right? Individuals are exempt if you're asymptomatic, it's been less than 3 months or the 90 days, and no new symptoms have developed. You are excluded from quarantine. So once again, this is in a table for you to read and have, and it will be posted on the chat. Vaccinations. Okay, this is very important. We, Houdini Incorporated Wine Country Gift Baskets, believe that everyone has a choice, and we respect your decision regarding your personal health care choices. Okay, in connection with our injury and illness prevention program and our requirements to provide and maintain a safe and health workplace for all our employees, Houdini Inc. Wine Country Gift Baskets has adopted a non-mandatory vaccination policy. What this means is that we're not forcing anyone, we're not mandating anyone to go get vaccinated. We've had people comment and say, why do we have to go get vaccinated? No, we're not mandating that. That is your choice. If you choose to get vaccinated, great. All we do is ask you to provide us that information so we can record it, and I'll explain why. We strongly encourage employees to receive the COVID-19 primary vaccine series and booster to protect the health and well-being of employees, their families, our customers and visitors, our contractors, and the community in which we live and serve from infection exposure that may be mitigated through the effectiveness of vaccination program. So this, by law, we have to let you know that we encourage it, but we do not mandate it, right? By state requirements, Houdini Inc., Wine Country Gift Baskets, is tracking vaccination records of employees, okay? We'll request the dates you were vaccinated for COVID-19 if you chose to get vaccinated. Okay, and that's why we've sent out emails saying if you've been vaccinated, please provide this information. And this is what we do with this information, right? So by the state requirements, we have to have a vaccination percentage. We have to have a vaccination program. Okay, we chose a non-mandatory vaccination program. So we're not mandating for everyone to get vaccinated. But for those that do choose to get vaccinated, we're asking for you to provide that information. We document it. We've asked you to upload it into Kokomo 24/7, or if you choose not to do that, just simply send it to Stay Safe, right? And we'll validate it and we'll upload it for you. So when there is a case of COVID-19, information is sent to our insurance company, to the Orange County Health Care Department without names. We do not provide names. We just provide a case, where it occurred, how many people were exposed, and they ask how many people have been vaccinated or the percentage, and then what procedures we have in place, what have we done, what kind of training do we do, what notices have we sent out. And if they decide that we're not doing the right thing, they may decide to come and do an inspection. And if they find any flaws, if they find that we're not doing what we're supposed to be doing, then we could get fines. And this is how we use the information. We do not provide any names. So all information that is shared with us is kept confidential. So vaccinations. If you have been fully vaccinated and boosted, contact Human Resources or upload your information to Kokomo 24/7 to establish that they are fully vaccinated. Employees may present a digital copy of their COVID-19 vaccine record. People have chose to do the California one, which is at ca.gov, or that link there. Once you provide that information, we validate it and we post it in your app for your view only. No one else can see it. And we do not share this information with your supervisor manager either. If they ask, we say, sorry, we cannot give you that information. We're not out there telling people who is and who is not vaccinated. We just have the numbers, right? And we can share that. There is no cost to be vaccinated at the following providers. You can check the links, Walgreens, CVS, or you can go to the California Department of Public Health for your walk-in clinic finder at myturn.ca.gov. So for those of you that would like or choose Pfizer, you have to be 5 years or older. It's a 2-dose primary series given 3 weeks apart. For a fully vaccinated 2 weeks after your final dose is primary series, you'll be considered fully vaccinated. Your booster dose should be ages of 12 and over. It's recommended 5 months after your second dose. And when fully boosted, a person is considered boosted up to date right after getting their booster shot. Okay. For those who choose Moderna, 18 or older, 2 doses given 4 weeks apart. 2 weeks after your second dose, you'll be considered fully vaccinated. Booster doses for 18 or above, 6 months after your last dose. And you'll be considered boosted or up to date after your booster shot. For those who selected or are looking into Johnson & Johnson, 18 years or older, 1 dose is a primary dose. You're fully vaccinated 2 weeks after that dose. If you are eligible and take the booster, it has to be at least 2 months after your first dose, and you'll be considered boosted or up to date after taking that booster shot. Vaccinations continuing is COVID-19 vaccination will protect you from COVID-19. Well, will help protect you from COVID-19 in the following ways. Will help create an immune response in your body against the virus, so it creates antibodies. It may help you from getting severely ill, even if you get COVID-19. So even though you get vaccinated, you can still get sick, but this is how it helps you. We encourage you to learn more about the vaccination by visiting the CDC website, to get more information. If you're still undecisive or you want more information about the vaccines, you can go ahead and get that information there. Testing. So who should get tested? Anyone experiencing any COVID-19 symptoms, anyone who has been exposed to someone who has a confirmed case of COVID-19, and if an outbreak occurs in the establishment, meaning here at work. COVID-19 testing will be made available at no cost to the employees within the exposed group. So if there is an outbreak here, which we did have one in December and one in January, and we did provide testing at no cost to the employees, and it was voluntary. We did not mandate everyone to get tested. It was totally up to you. During employees' paid time, so we did not ask you to go get it off work if you were in during the outbreak. There was a couple employees that says, oh, I can't do it during this time. So we gave them an appointment and they went and did it, but it was also during their working hours. It was not off work. For whatever reason, we will work with you as much as we can to follow these mandates or these requirements that we have to do. The following exceptions apply if something occurs, you will not have to test if an employee was not present during the 10-day exposure period. An employee, and this is how we can validate that through the Kokomo app. We analyze it when there's a outbreak, who was here, who was not here. If you were not here in that period, then you're not considered to be exposed, so you will not have to get tested. Employees who are up to date with their vaccinations, and this is how we also validate through the app. We can research and analyze who's vaccinated and who's not, and then we can say, oh, you're excluded from getting tested. COVID-19 cases who return to work with remain COVID-19 symptom-free. Again, that is communication through the state safe team. And COVID-19 cases who never develop symptoms, and it's been 90 days, within the 90 days of the first positive, and that's communicated through the state safe team. So once again, if you want more information about testing, you can go to covid19.ca.gov, get tested for more information, or you can contact Human Resources or State Safe Team, and we can help you with further information on that as well. So at this time, if anyone has questions, we can go ahead and answer them. I don't know, Griselda, if there's any in the chat.
Yes, let me check. Hold on, check. Okay, so right now there's no questions on the chat. Let me unmute you guys. So, okay.
Anyone with a question, raise your hand and we can call on you.
Okay, so there's someone, Jahida.
Okay.
My question is, when we do at home test, how do we submit it to Houdini?
Oh, good question. I missed that one. Thank you very much. So when you're doing a home rapid antigen test, there is going to be a link in this chat. So you want to click on that and enter in the product name. And if it comes up in the FDA approved list, it's good. If it does not come up, then that means it's not approved and you'll have to get another one, right? So what we're doing now, because the rapid test, there is no real form or documentation unless you go to a clinic. What we want you to do is put your name and the date on the actual test kit and take a picture of it, and that's how you submit it through the Stay Safe team or through the app. Does that
Sounds
answer your
good to me?
question?
Yes, thank you.
Good, thank you.
All right, any more questions?
No questions?
Okay.
Good. So help us stop coronavirus and hopefully we can get back to normal this year, right? So thank you very much for joining us. See you soon.
All right. Thank you.
Thank you.
Thank you.